developed, which has been generated in clinical trial. So you might enroll 10 patients. There would be certain amount of data like fact B questionnaire will be there. The quality of life of patient will be assessed. So this depending on this data, you cannot publish any paper. So it is the right of sponsor. The data belongs to sponsor, and sponsor can publish it. Okay, but most of the times, few investigators will be co-PS of the co-authors of the publications, which is made by sponsor, right? And there will be details of insurance and indemnity. Indemnity means taking the responsibility or removing the responsibility of any injury or anything from someone else. Let's say for example, sponsor removes the responsibility of trial related injury or drug related injury from investigator and takes that responsibility for himself. Like all the payments related to SA or the injury compensation will be paid by sponsor, and it is not to be considered as responsibility of principal investigator. So this is something called as indemnity. Okay, and there will be clauses regarding how the document should be stored, for how many years should it be stored, what should be the archival facility, etc. Clear till now?
Yes, sir.
So I don't know why numbering is not coming, but this is the continuation of previous points. Okay, and if any dispute happens, how should we resolve the dispute? Should be written in the CTA.
Excuse
So
me, Dr. Pratik.
yes,
Sorry for the interruption. Can you please repeat that publication privacy?
yes. See, so publication I'll show you in the main CT as well what it will be actually written, but I'll just tell you the summary of what will be written in most of the studies. Okay. So let's say you are the principal investigator. You are doing the study. So you will be collecting a lot of patient information. You will be entering it into like ECRF, something called as ECRF or paper case record form. Okay. So this information, any information you are generating through clinical trial, you cannot publish it. Okay. So only
Publishing means it's like general or
general.
okay.
General or any kind of publishing. You cannot write a blog article. You cannot write anything using this data.
Okay.
Understood? So this data belongs to sponsor. Only sponsor can use this data and publish this data anywhere, right?
Is this only applicable for clinical trial or any research projects, sir?
See, it will be applicable to most of the research projects which are sponsored.
Okay.
Okay. So if and it depends on who owns the product. See, you are principal investigator, right? You have initiated a study. Let's say you have initiated a study regarding already market available drugs, but it takes some amount to do the study, right? So you have seeked funding from some organization. Okay. So that organization is only a funding organization. So it doesn't own the drug or doesn't own you. But you have a general responsibility of telling that sponsor organization what are you going to do with the data, what is the publication policy. So in that case, the sponsor will be little loose on the publication terms. But this product which you are doing clinical trial for is a complete proprietary product of the company, right? And the clinical trial patients and clinical trial information is very confidential because before releasing the product or before coming into market, the results will depend on this data. So and also this will be an individual. So many studies will be multiple center studies, correct? Multi-center studies. So even if you publish it might not represent a true picture of what you're trying to do. Because let's say there is sample size of 150. So 150 patients, the sponsor is not going to recruit in one center. They will pick multiple centers, like say 15 centers across India. So even if you publish it, it will not give you a proper picture of what is happening with the drug. So That is how the publication is, the data is protected by sponsor. So everything will be written in the CTA. So it's very important to read the CTA, understand what legalities are binding you in doing clinical trials. This is most important, right?
Yeah, okay.
So, but at the final term, the sponsor needs to publish the data, right? So they will pick few investigators. Okay, they will pick few investigator or all investigators as co-author in their publication. Okay, your name, your center name, everything will be there in the publication. So you have done it and you will be credited properly. But you can't bypass the sponsor. That's what I'm trying to say.
If we want to participate any conference or something, we don't want
No,
we.
you can't. You can't. Even if you participate, you can simply say that we are doing so and so study, not even the title. You are doing the study related to breast cancer at our center. Only that much you can say. You can't you can't reveal the title, name, and many details, even though it's present in clinical trial registry. But you cannot go and
I'm asking that if we want to attend a conference, like a poster presentation or that, we can't do that.
no, you should never do that. You can't do that,
Okay.
but you should never do that as well.
Okay.
So
It means if we don't have a right to publish or anything, right?
anything, nothing, nothing, not anything, nothing. You have right to publish nothing from the clinical trial.
Okay.
So because that, see, let's see in the later slide how much it costs to develop a clinical a drug which comes into market. It costs millions of dollars, you know. And after doing clinical trials, what would a sponsor get? You tell me, from the site, what would he get?
He will
Data.
get the data.
Data. So after spending lakhs of rupees on investing on this site, doing clinical trial, data is its outcome. Data
Yes.
is his outcome. So he should protect it, right? Sponsor.
Mm.
It makes all sense to protect that data. So it is like that. Okay.
So,
Yeah.
apart from PI, who all others will get the authorship?
Yeah. Yeah. See, authorship, it depends on some sponsors will make high recruiting sites as author, as one of the second author, third author. It depends, but the recruiting sites or participating centers names will be properly acknowledged. That is for sure. Will they make authors of everyone? We cannot guarantee.
Like the other day, Harisa was explaining about delegation, like who all will be delegated to the study.
See, delegation is something different. See, delegation has nothing to do here.
Oh,
Delegation
okay.
means principal investigator has responsibility of entire study. He can do everything in the study, but he will assign someone to do some activities on behalf of him.
Okay, okay,
So that is
understood.
called as delegated, like just employing a CRC.
Mm-hmm.
Okay, even though principal investigator write all the documents, it is not practical to write all the documents himself. What is going on day-to-day activities, like patient came today at 10 a.m. All those things CRC will be writing in the source notes. Okay,
Okay,
so
understood.
he will delegate that document. So like that, understood. And can we move forward? Yes, no,
Yes, sir.
Yes, sir.
yeah. So again, there should be guidelines for, there will be guidelines for dispute resolution. So they will write that we will resolve anything in mutual in good faith, or if we cannot resolve something in matter of 30 days or 40 days, let us go to so and so court. So arbitration or the legality will be binding to Mumbai area or Hyderabad area or throughout the courts all over the India. So this is very important. So if you are in the place of Hyderabad or Mumbai, so where the sponsor wants to settle the arbitrary, settle the dispute, in which courts they want to settle, or in which courts you want to settle is very important, right? And of course, the duration of agreement, a term of agreement of for how many years this agreement is valid is also important. and amendment terms will be written like in case of any amendment. So how many days prior notice it should be given to investigator or site, what in which process amendment will be deployed. All those things will be written. And communication addresses will be present in case of legal communication or for any general communication. Addresses will be present of all stakeholders involved in the agreement, and finally signatures will be there. So got an idea of basic components of a CTA?
Yes, sir.
Yes, sir.
So let's review the CTA once slowly. Starting from the date, it's important. Okay. Can you see the screen?
Yes,
Sir.
sir.
See, once you're signing the agreement at the last page or wherever the signature page is there, the same day you will be keeping the date. So on from which day this agreement is being enforced is very important, because this is, let us consider this is to be primary agreement, the beginning agreement. So there could be amendments in the agreement. Let's say PI feels that the coordinator salary is being not enough, or the investigations at the site or the hospital fees has increased, their cost has increased. In that case, the PI can communicate with sponsor and get the revised budget if they approve. Okay. So upon that, this date will become very important on which day it was approved. So only from that day you can claim the revised cost. Otherwise, you will be in loss, right? So this will be made on this day, and it will be written like from which day it can be approved. It is valid. So that should be checked.
Sir,
Date
can
should
you
be checked.
repeat it once again?
See, the date of agreement enforcing should be checked. Okay. Because all the terms written in the agreement will be enforced from this day onwards. Okay.
Okay.
So let us say when an amendment comes, okay, for increasing of your CRC salary. So PI has requested for increasing CRC salary, and the sponsor has sent you a new amendment upon this agreement. Amendment means new version. Amendment upon this agreement. Now, the date it is signed is important, and also the date from which it is enforced, which can be enforced, is important. So the sponsor writes this increased salaries can be enforced from, let's say this is June, from January 2022. So you can claim that increased salaries from January month. Even this is June, you can claim it from January month. So it is very important to check the dates.
Okay.
Understood?
Yeah. Understood, sir.
Yeah. And it will be between, so they will be written the stakeholders who are stakeholders are participating in this trial at the site. So this is a site level agreement. So there can be agreement between sponsor and SMO as well, or sponsor or any service provider. So sponsor contacts a lab for providing for testing the samples which site sends to them. So there will be separate service agreements for them. But this we are speaking is site level agreement, and this we will encounter routinely, right? So there will be sponsor like the FGG, a company. These are just demo names incorporated under so and so, and they will be called as sponsor. And it will be, there will be, here it is called as first party. You can name them like someone calls them as a sponsor, someone calls them as first party, second party, third part. So here it is called as first part. So in wherever they will be mentioning, they will be mentioning themselves as first part or sponsor. Okay. And it is between principal investigator called Ajay, who owns a department of oncology or at Vidyanagar, Hyderabad. So he will be referred to as investigator from now on. He is a second party. And it is between SS hospital where this person Ajay is working. Okay. And between a SMO. YY Research, which takes care of research activities at this hospital. Okay. So what kind of agreement is this?
Quadripartite.
Correct, exactly. See here it will be written now all these. So whenever parties are termed, parties are written, it means all four, not one or two. Wherever parties is written, it means all four: sponsor, investigator, institution, and SMO. Okay. So who is written in detail here? Like FGG is a drug development company who will and is a pharma company, and the hospital is a government hospital, and investigator is a principal investigator who will carrying the person who will be carrying clinical research. So basic identity of to make sense of their responsibilities is written there. Who is who, their role. So here this is important. Like in consideration of the payments and mutual premises and convenience contained herein and with the intent to be legally bound. So all this means is below is general definitions, right? So to get any payments or while you're speaking in legal terms, so you can use these definitions as reference, right? So I have spent, so PI says I have spent so and so amount for adverse events. So what does this adverse event means in this legal document is written here, right? So key definitions are stated here, like what does this adverse event means, like we all know, right? So this is important. What does commencement date mean? So that's what I was speaking about. Commencement date is important. So what does a confidential information means? Here you can see. So it means proprietary or confidential information of any party, howsoever disclosed, which relates to subject matter of this agreement, including without limitation to technical business information related to conduct of trial, subject of trial, trial material, know-how, methodology, trade secrets. So everything is confidential information in clinical study. So definition of consent form, investigator, case record form, what does it mean, electronic or printed? So everything is called as CRF. So eligible subject. See, if it is written in CTA, like for each eligible subject, we will pay this much. So, but there should be clarity. What does the eligible subject means in the first place, right? If they're told for the enrolled subject, we will pay this much. So there should be clarity. What does that enrolled subject means? Different people might interpret it as differently. So it is always better to mention it in the document. So it means a person who meets all eligibility criteria as set out in the protocol for enrollment of a subject or patient into trial at the time of selection. So eligible subject and enrolled subject is different. Eligible subject is only eligible up to screening per protocol, but enrolled subject is who passes screening procedures and on whom we started administering treatment. Okay. So this is important. So ethics committee, GCP, ICH, what is ICH GCP means. So who is an ineligible subject? That is also important. What is inspection means, investigator product. So like this, there will be different definitions. So we should also check all the definitions are present or not in the agreements. So and also SAE definition is very important. It should definitely match what is present in the guidelines. Okay. So SAE will cost site a lot. So whenever SAE happens, how the payments are made is subject needs to be admitted in the hospital and he needs to be treated until it is proven that the SAE is related to drug, okay, or not related to drug. The payment is being given to manage the subject initially. So initially within 24 hours it might not be possible to rule out that this is related to drug or this is not related to drug. Means initial doubt also cannot be ruled out, so we need to do some investigations, etc. So in that case the SAE payment will be released up to that extent. So once it is proven it is not to be related to the study drug, it is confirmed, So in that case, the payment will be stopped and subject should have to bear from his own pocket of that injury. Let's say, for example, subject had some liver problem, elevated AST, ALT level, severe pain. For that reason, we had to admit him into hospital. So, but if it's a previous injury or previous hepatitis or a episode of liver damage, so in that case, we got to know it recently. Patient did not tell you, you got to know it recently. So in that case also, subject has to bear the cost because it is not related to trial related procedures or any accident. For any accident, subject has to be admitted. So even that is a serious adverse event. So yeah, accident admitted more than 24 hours, it's a serious adverse event. Though it's related or not related to drug, it should be considered serious adverse event. But the compensation will not be given or the treatment will not be provided. So what the services mean will be written. So here in this CTA, there are many ways of writing the CTA. Someone will write it as it will be mentioned in Annexure 2. So all the responsibilities, roles, they will make annexures like Annexure 1, 2, like index 1, index 2, index 3, and they will quote that Annexure number. So at the end, the principals will be present. Okay. So what does the termination date mean is also very important. So by termination date, what all you are going to terminate. So means the date when parties have performed their respective obligation and the agreement or terminated in accordance with terms and condition of this agreement such earlier date. So this means is you are done with all the obligations written in this agreement, and from the date of termination of this agreement you are not binding to this agreement. So what does trial materials means is also important. So like this, so the term is written here until how many years. So some agreements will be till 5 years, 6 years, 3 years. So here this agreement is up till the termination date, will be valid up till the termination date. That would be most probably by the end of the study. There will be general obligations of the institute and investigator. Okay. And here, as I told you, there are mentioned in Annexure 3. Here, Annexure 3. This is page number 5. See, they should follow all the rules and regulations like protocol, and other document in Annexure 1 and subsequent amendments, ICH GCP rules, new clinical trials rules, and other local laws and regulations. That is Annexure 3 about. So there will be responsibilities of all parties as Annexure 1, I guess. Yes, Annexure 2 will contain responsible description of responsibilities. So here, obligation of institution and investigator. So let us see what the investigator shall do. So he should definitely appoint professionally trained, experienced, and qualified personnel to perform the services under this agreement. So here, earlier we were talking about delegation. So doctors should delegate only persons who are qualified to do that task. Let's say, for example, there are 15 different tasks to be done in clinical trial routinely, like from writing the document, collecting medical history of patient, checking their vitals, dispensing the medication, like giving the medication, preparing the medication. If the IV is there, you have to prepare the IV medication, right? So if the CRC is a pharmacist, okay, he can be delegated for preparing and dispensing the medication, but he cannot be delegated to administering the medication. So who can administer the medication?
Nurse?
Yeah, nurse can administer, doctor can administer, but pharma person cannot administer, right? So the PI should be careful about whom he is appointing They should be trained, experienced, qualified, and they should be delegated to whatever qualification and experience it allows them to be delegated, right? And they should appoint co-investigator who meets the conditions stipulated in Annex 3. That means they follow all the rules and regulations that would be written there. Use all reasonable endeavors to ensure smooth running of the trial at all times. So, and they should act professionally and responsibly to and should create necessary interface and platform between co-investigator, institute, and site. And they should collect all the required information regarding to protocol required information from subjects or during the trial. Okay, and immediate reporting of SAE or AEs is very important. So in India, a reporting period is within 24 hours of happening of an serious adverse event. You all know what serious adverse event is, right?
Yes, sir.
So again, full cooperation is required from the PI from whatever term this agreement binds to, or for whatever term the clinical trial is happening. Okay. So for any additional approvals or any emergency unblinding or such kind of things, so PI should inform the sponsor and take prior approval. And he should also ensure that the product is being used for the intended purpose, okay, by the patient as it should be used. If it's the tablet, at how much dose it should be used. See, some medications required to be used prior evening, so it might disturb their sleep cycle. So all these kind of precautions principal investigator is responsible for. See, as you are seeing, these all are the responsibilities of your principal investigator or site. Okay, so these responsibilities, some of them will be delegated to people. And one more important thing is, I think we have, okay, see, prior to commencement of the trial, so investigator has to check certain things like have to regard to the scope of the trial, eligibility criteria of the subject. So all this means is, so investigator should have an idea. So is it possible to do this study at this center? So now we have promised like we will be enrolling. It is so they will be getting 100 kind of patient each day for they will be visiting. Like say 50 breast cancer patients will be visiting OP daily. We can randomize or enroll at least 2 to 3 patients, right? So you are given a picture, and but later you cannot say that no, this is not feasible, we cannot do the study. So in that case the agreement will be cancelled. So prior hand, principal investigator should check everything like eligibility criteria, protocol, equipments available. Okay, so like that. So investigator, it's the investigator's responsibility to submit all ethics committee approvals, documents for approvals. And storage and administrator of product should be overlooked by PI. And it is the responsibility of principal investigator to train all his staff with protocol information or any study related information. The new CRC, so you have appointed a new CRC, so it becomes the investigator's responsibility to train them properly on protocol and trial specifications. So like this, there will be responsibilities. So it is very important to read each and every point in the CTA. So if you are, let's say you are working as a coordinator there, so some point might be there which your investigator is not aware of. Let's say, for example, like insurance is there or something is there which is missing in the CTA, or which says so investigator site is responsible for procuring insurance, something like that. So it will become a big loss to the institute if you overlook any point. See, most of the times, let's say, sponsor will many times sponsor will train the CRC, so there will be ECRF systems to train the coordinator or study nurse digitally through for the protocols and administration procedures, etc. So let's say the sponsor has missed to be trained, and in the audit, it is found out that the CRC was not trained, protocol training was not complete. So there will be protocol training log or general training log where all the required training should have been completed, like ICH, GCP, protocol, etc. But the sponsor has not trained, and investigator thought the sponsor will train, then it will become a problem in DCJ audits because they will clearly say that we have written that it is the investigator's responsibility to educate everyone, and we have trained the investigator, but the investigator did not train. Okay, so you should be careful regarding those point as well. So are you getting a picture like how it will be written?
Yes, sir.
Yes.
Yes.
See, here again, it will be written for how many years document should be retained. See, and at least 2 years after the last approval of marketing application in ICH region. So this is very clever way of writing. So they are not 2 year here. 2 years doesn't mean after study completion. See, you are doing a phase 2 study, let us say, and here what they are saying, uh, at least after last approval of marketing application in ICH region. That means when will the marketing application will be put? Only after end of phase 3, right? Which will take at least another 5-6 years to complete. Okay, till that time you are going to keep the documents, right? So these kind of points you should be very careful about. So generally, the general norm in today's market is PIs are or sites are supposed to store the document for at least 15 years. Okay, they're storing the documents for at least 15 years, and they should have the capacity to store the document. If not, they should inform the sponsor before that we cannot store the documents. So archival process after study completion should be taken care by sponsor. In that case, sponsor packs all your documents and stores gives it to some third party or organization which can store the document for that particular period of time if you don't have that facility. So here is the sponsor responsibilities, FGG sponsor. So his responsibility is to ensure that IP is supplied, manufactured as per protocol and supplied to site, and it complies with all ICH GCP guidelines. Prior to commencement of trial, FGG shall prepare and finalize protocol. That means it's their responsibility to prepare protocol, give amendments, okay, give monitoring plan, do source data verification. Okay, source data verification means a monitor or person from sponsor team or CRO team will come and check the document. You will be entering into electronic case report form. You will be seeing patient files and you will be entering like, okay, today's weight is this much, today we have dosed the patient this much, so these are the side effect patient got today. So he will come, he will check, cross verify, and do something called source data verification. He will tick it as verified, correct. Okay? So that is the responsibility of sponsor. Okay. So it is his responsibility to appoint a principal investigator or medical monitor. There will be some person called as medical monitor at the central level. So whenever a PI gets any doubt related to study related procedures, so PI might be well aware of his medical practice, but they might not know. So protocol will allow or not allow some things to be done in cases of dose reduction, etc. So medical monitor will be present as central team whom the PH can contact. So it will become easy to communicate in the same language. Then the medical monitor will help the investigator or site in what action to be taken care in such cases. Okay, let's say for example, uh, so in cases in many protocol there will be dose level like 800 mg, 400 mg, same drug, 800, 400 and 200. So when you get these many number of side effects or this grade of side effect repeatedly twice, you have to reduce the dose for below level, okay, 800 to 400. but the PI feels that this side effect could be repeated. So based on his evidence or lab report, he opines that this side effect will come again in the future. So in that case, if it was not a clinical trial, PI could have just reduced the dose, right? But as this is a clinical trial, he needs someone with medical knowledge to give that approval. Okay. So their medical monitor comes into picture, then he can say his opinion and approve that decision. Okay. And again, they will sponsors responsibilities to review AEs, SAEs happening at site levels. Okay. And also to submit SAEs to the DCGI or health authorities. And sponsor responsibility is also to notify all sites related to essays happening at all other sites. Like I'm doing the same study in Hyderabad, and there are 10 other sites. So in whichever site essays might happen, so that notification comes in the form of SUSARs to all the sites. Okay. So all investigators will know that this kind of uh, essays has happened at particular site. So here responsibilities of parties means who is the parties here?
All the four
All the
sponsor,
four.
SMA.
So should remember that this is related to all the four. Okay. So these will be general, like institute and investigator will cooperate, everyone will cooperate for smooth conduct of study. So these will be general terms. Okay. So these will be these are the responsibilities of site and sponsor. So let's go back to our main document. So there is a way of writing documents. So some documents mention this in the subsequently in line with let's say there is a column of this PI will follow these and these responsibility. There itself they'll write, but some agreement will mention it separately. They will make annexures and they'll quote the annexures in the main text, right? So these are the general obligations. So see here, if there is payment, some sponsor will write payment here itself. So these will be the payment so and so. But some will set it out as annexures. Okay. So in order to get payments, we have to send something called as invoices to the sponsor. So that is what they are meaning by invoices. Okay. So once that visit is finished, that visit has cost you this much. So in routine, what it happens is sponsor will pay you the amount for that visit once the monitor confirms the data of that visit. So if that visit is confirmed, you have entered all the lab reports, but the monitor will come and verify, do the source data verification. Once the HDV is done, you can raise the invoice against your cost. Okay. And that time payment will be made. So what is the invoicing time period? So in how much time the payment will be made is written. See, fee will be pay the institution, FGG will pay the institution investigator sum of so and so within 30 days of receipt of that such invoice. Okay. So you should be very careful. So you should know that okay, this is the 30-day invoice period. So this is our cost. So we have to bear this cost for 30 days. Got it? So in some institutes will give principal investigator a credit. Okay. But the credit period, see, I'm working in some hospital, let's say Apollo Hospital or some hospital. So in order to encourage clinical trials, they will give credit for clinical trial patients or for that principal investigator. But the credit period might be for only 25 days. Okay, in the 25 days, principal investigator needs to settle that amount. Okay, he has performed the lab test in the clinical trial, local lab test, which cost him, let's say, 10,000 or 15,000 for CT scan MRI. But the investigator needs to pay it in 25 days. So then this will become a problem, right? So it is very important to know in how many days you will be getting the payment. And so a sponsor company might stop your invoice if it founds the invoice to be inaccurate. What it means is, so the test has cost you 500 rupees actuals. So, but you have sent the invoice for 700 rupees. So, but if the sponsor find out that the cost you have sent is inaccurate, then it can suspend the payment of that invoice, right? Here, indemnification means, as I've told you, review taking someone else's responsibility on behalf of them. Like here, sponsors take the responsibility of paying for essays or trial related injuries. If anything happens to subjects or any party, then it is the sponsor's responsibility to pay for that claim or pay for that damage. But it will not pay it in case of any failure of institution, investigator or its affiliate contra agents to perform trial in accordance with protocol, ICH, GCP, local regulation, etc. So if you are not performing the trial according to trial protocol, let's say the patient needs to be dosed every 3 weeks, okay, and you have missed to dose the subject for 1 week. So that means for 1 month you have missed to dose the subject, but now the subject, because of not getting the drug, his disease has increased and got some side effect or SAE. So in that case, because it is due to failure of investigator to follow the protocol properly, then this indemnification will not apply. Got it? Then it will become the responsibility of investigator or that site to take care of the patient. That means financially. Improper or negligent administration or use of the investigational product during course of the trial. See, investigation product will have a pharma manual or the procedures how it should be administered, in which aseptic condition it should be prepared, okay, until which duration it should be administered. Now it is written like you should use a infusion pump to administer this product for 30 minutes accurately. So by using the IV line, you may not administer it properly for 30 minutes. It might go like 40 minutes, 35 minutes, etc. Right? So, but you are not using that product, or due to fast infusion rate, some infusion related reaction has occurred. So, in that cases also, i- so sponsor will not be responsible. So, any breach of section 10, 13. So, these are section 10 according to me is confidentiality agreements. Okay, leak of confidentiality thing. So someone has, you have leaked your patient's information, like you are participating in he is participating in clinical trial to somebody through site level. It has happened. Let's say now some party has contacted the patient to participate in other clinical trial or something like that has happened. Or if the patient sues the company or investigator that he has revealed his name, that he is participating in clinical trial. In that case also sponsor has no responsibility. Okay, like any negligence of misconduct, malpractice, material deviation, breach. So this is, if you do any mischief, then sponsor will not be responsible for covering your damages. Okay, like this, there will be conditions under which sponsor will pay. So sponsor is responsible, will take responsible of payments of every damage happening due to investigation product. But if it happens due to this condition, then it is not the responsibility of sponsor. So it is very important you do clinical trial in a proper way, in a timely way. So so if it is at investigator level, it's very important to train the coordinator properly, to make them aware of the administration procedures, IP procedures, what our documentation needs to be written on daily basis. Okay. So though these are 4 points, it seems it will cover all the deviations done by principal investigator, as these are broad terms used here. Okay, so if you are not doing trial according to protocol, means protocol has everything, right, what you need to do. Even if you miss small thing, it will be written in protocol, then this rule will be applied. Understood? See, local regulatory requirements, ICH and everything comes under this broad term. Okay, so while doing clinical trials, it is very important to follow all the rules and regulations, protocol, and proper communication is very important with the sponsor before taking any decision. So this is there. So some other rules will be there for indemnification. Who is indemnification party? Who is indemnifying party? Like that means sponsor and institute like that. Limitation of this liability. So this same like previous how it is written. So this agreement will act or seek to restrict, limit or exclude any liability for death percentage caused by negligence, right? If the subject has died due to negligence of site, then the PI is not responsible. The sponsor is not responsible for that death. So DCGI in India, insurance is must to be conduct a clinical trial. So this is the essential requirement. But the point is, who is paying for the insurance is important. Like say, if an essay is happened, sponsor will not pay from his pocket. So there will be something called as clinical trial insurance with third parties. So sponsor will do insurance with them. In any case of essay, that insurance party will pay. So let's see what it is written here. Here it is written, institution and investigators are secure and maintain in full force and effective throughout the performance of the trial insurance or self-insurance coverage for medical malpractice and general liability in amounts appropriate to conduct of his or her business. Institution and investigators shall also require any subcontract to secure and maintain such coverage for his or her active trial. So here it is not clear. It is not clearly written that sponsor shall provide insurance, right? So these kind of points should taken clarity from the sponsor. Like it's okay, you have written that we have to maintain insurance in cases of medical malpractice with damage. So there is something called as insurance for doctors, which covers in case of any errors or in case of any uh, basically errors which happens in the medical practice. So in that case also insurance provider will compensate. Understood?
Yes, sir.
So here it is not clearly written that sponsor will provide insurance to all for essay or for trial related injury, but it is only written about what the institute needs to do. So these are the points you need to catch hold of in agreements, and you need to take clarity from the sponsor or get it changed. Otherwise, who has to pay for the damage? Insurance cost?
Um,
Sir,
Yeah, if it's not clear, it could go either ways, right? So what do you mean by confidentiality information, and what is publicity? So what can you publish is written here. Okay. So all this thing is confidentiality information shall be strictly treated as confidential and shall not be disclosed to any person except to the extent that any such disclosure necessary to be disclosed, as I told, like drug destruction, etc. Yeah. The parties understand, acknowledge, and agree that all results and data from the services in whatever form, etc., are exclusive property of so and so company and cannot be used by institute. Here it's written, used by institute or investigator or co-investigator agents or others then person to perform a services. Or so you cannot use this data as well. Let's say you are running some additional project, some other study which measures quality of life of patients, and in this study also quality of life of patients is measured. So you cannot use this patient's data, or you cannot use these forms to uh, divert those results to your study. Though it might be simple, you cannot use it. Okay? So you cannot disclose the information to your employees, any of its other employees, agents, personnel, to any person, including directly or indirectly to other person other than sponsor. Okay. So investigators should take all the precaution mentioned. Section 10 means this is section 10. All points written in section 10, it becomes the investigator's responsibility to take care of confidentiality. So if they breaches, it shall be considered as material breach or by the investigator of this agreement. So who will be made responsible for any breach here? Hello.
Investigator.
Yeah, true. So if any breaches happened, so primary responsible person, the case will be filed on investigator. So investigator will be sued first by the sponsor. See, there are the restrictions. There are some conditions in which investigator can speak about that information. So this is, and the section shall not apply to any information which at the time of disclosure is freely and lawfully in the public domain. So the study results are published already. Then you can say about the study result in public domain. Okay. So if the investigator, so he knows that that information prior, like the same thing is written in 2 or 3 formats. So both these points will also mean this only. Okay. So if it's available freely publicly by other sources, then investigator can speak about it clearly. But if it's still in the proprietary stage, trials are ongoing, then you cannot disclose that information. So someone has asked me when we can publish in a conference or not. You got an idea? Hello.
Hello.
Yeah.
Yes, Pratik.
So if the results are published, then of course you can speak about it. So even if the interim results are public, so there is something called as interim publications, right? You might be aware of. So in the middle of the study also, interim publications will be done. So those results you can tell. So
So if the study is not yet completed and they have, they can provide a very little conclusion. So that can be an interim publication, right?
no, interim publication means proper publication. Interim means middle publication. So let's say your plan is to enroll 150 patients. You have enrolled 70 patients. But the sponsor thinks so interim analysis will be done always. So for each 20 patients or 30 patients, the statistician analyzes what is happening. So in the statistical analysis, they found out something remarkable, like some drug has been curing all the rectal cancers, right?
Yeah, that was say my question actually.
See, here. So like that, the sponsor will publish that interim results. So he will write the study has not been completed. This is the interim. So interim publication means everyone will understand. So these are the interim results. So we have enrolled 70 patients until now. So these are the results. These are the good prognostic factors we have found out while using this drug. These are the good outcomes which seems to be improving the patient's survival time, etc. So if this is published in proper journal by sponsor, okay,
Oh,
now you can show it anywhere else because anyone can access it, right?
yes, sir.
So in that case, you can show it. But if it is an internal report, mind it, you should be very careful. If it is an internal report, the sponsor has sent the interim analysis to you without he has not published it, but he is sharing through the to all the principal investigator to get some idea. So we got these many side effects. So these are the expected duration of life, expected survival period by using this drug in this 70 patient. Now the PI will get an idea even to communicate with the patient. Okay. So how is it working till now? How many patients they have done the trial? So this information is needed, right? So this internal reports you cannot go and put it in a conference. Only if it's published in a public journal, proper scientific journal, then you can present it. Got it?
Okay, understood.
Yeah. So these are some general warranties which each one will promise. Like investigator has to make all the site ready before starting the trial. Like the small agreements will be there. Okay. See, so all the duties perform that all the trial related activities comply with all applicable law, including anti-bribery, anti-corruption, and will not take any action that will cause sponsor or affiliated to be violation of any such law. So these will be some basic responsibilities. And institution or PI will follow all the regulatory local laws, rules, etc. So these are general things. So this is very important. So what in the case of default? Default means failing to do particular activities which is intended to do. So you have promised to enroll at least one patient a month, but you are not enrolling any patient since 1 year. So in that case, it is called as a default. See, if any party breaches any of its obligations under the agreement and fails to remedy the breach within 30 days of written notice, then the given by other party identified requiring the breach is to be remedied. So within 30 days, it has to be settled, any kind of breach or violations like that. So, these are the parameters for termination of this project. In which condition this CTA will be terminated, this agreement will be terminated. So if the party become insolvent, dissolvent, so that this all means if the hospital is closed down due to loss or it is shut down, then in that case. So if the conducting of particular service is prohibited by law, in that case also it can be, let's say the suddenly government has banned clinical trials for 1 year due to COVID or something like that. So in that case, it means no point to continue the trial at the site. So like that. So here this is also very important. Either party may immediately terminate this agreement by notice in writing to other party if a default by other party occurs. Okay, so this is the default. If it occurs, they can terminate the project. So one point they can write you a mail that so you can divert the patients to another hospital which is already doing the study, and we want to terminate the study here or this agreement here because you have not followed so and so things. So important thing is, if there is unsatisfactory progress of services or the trial. So here, if this is written, this is very vague term. So you should take clarity what they mean by unsatisfactory progress, right? Now the sponsor might send you a mail. You have, let's say you have done your investigations. It cost you some 1 lakh rupees. Now next day sponsor is saying that the progress is unsatisfactory. So we expected you to enroll this many patients, but you have not done. So we expected you to complete this many cycles, but it was not done. So the clarity should be sought prior to signing the document. What does it mean by unsatisfactory progress? Okay. Here one such condition is there. What it means by unsatisfactory? So if the patient recruitment is not initiated within 60 days of site initiation. So you all are aware of site initiation, right? What happens? No, yes. Hello. Are you guys still there with me?
Yes, sir.
So you are aware, right, of site initiation? What happens?
Yes, sponsor representative
Initiate,
is it?
Yes. So site initiation is a process. So all the agreements are completed, everything is ready, approvals are given from ethics committee. Something called a site initiation happens. That the sponsor person comes to the site, he trains the site people for protocol and he trains the PI for protocol, everything, he explains them, and he checks once again all the requirements are present and he initiates the site. That means he starts the site to be enrolling the subjects. From that day, we can enroll the subject into clinical trials. Okay. Now the site has been initiated. That means permission has been given to enroll patients. But within 60 days, you have not even started the process of screening patients or identifying patients. In that case, immediately this agreement can be cancelled. So these are the points you need to take care. So let's say this is rare condition, and instead of 60 here 30 is written. So you should be careful. So you have put in some effort, right, as a site to submitting the documentation, etc. For that period, you will not be getting any CRC salary or anything. After the study begins, you will be getting payments, right? So you have put in effort, but this is a rare condition. Let's say triple negative breast cancer, some condition which is not frequently encountered. Okay. So in that case, it might take you more than 30 days to find a patient or to do some screening. Correct? So at the site, you should be careful about looking at the protocol. What is the subject criteria and what your PI thinks? If you are PI, what do you think in how many days we could find one patient? Okay, even with if you find the condition, some criteria they might miss. Okay, this is also an important point. So any co-investigator ceases to be employed or to be engaged in the performance. So you are participating in this trial and co-investigator ceases to be employed. So your co-investigator left the site. Okay. Then in that case also they can be this could be discontinued. So this is also very serious point. So your doctors can leave, right? If it's a private setup, doctors also change their job. They change the hospitals. So this needs to be clarified with sponsor, right? So if the doctor has given notice period, then that needs to be communicated properly with the sponsor because this point is there here, right? So in that case, we need to arrange for another co-investigator and we need to continue. See, like in many times, that requirement of co-investigator will not only there for representing as PI because it will be required. So let's consider the treatment. The protocol includes comparison between standard of therapy and surgery, between this drug and surgery. Then the one investigator will be oncologist or medical oncologist, one investigator will be surgeon, right? So without surgeon being as co-investigator, if the surgeon leaves, it means you cannot continue the trial, right? Understood?
What if other surgeon?
What
We
if?
need to other surgeon, new surgeon comes, and can we do a new,
Of
you know,
course, see, new surgeon comes, you can do it, but you should inform this prior to the sponsor. You cannot put a mail that today our surgeon left. No. So they will give some notice period, right? So that can be only done if by mistake somebody dies or something like that happens. So then you will notify, but all communication should be made priorly with the sponsor. Like the co-investigator is leaving, so we are planning to appoint this person as co-investigator. Or if he leaves suddenly, also it needs to be communicated. Okay, and the sponsor holds all the right. If this point is there, sponsor holds all the right to cancel this study or this agreement because you have signed looking at this point. So by looking at the CTA, you will know your limitations and you will be very careful while conducting the study. Okay. And there is an inability to recruit an adequate number of subjects with this. So see, this is also a vague point. So you need to seek clarity. What do you mean by recruit an adequate number of subjects? Correct. So one day sponsor will write a mail, you have not recruited adequate number. So you might be thinking you are recruiting adequate numbers, right? So this is important. So these kind of points will be there in all CTAs, which needs clarity. May terminate this agreement upon 30-day prior written notice without cause. Okay. So this was immediate agreement. This is 30-day prior. On termination or expiry of this agreement for any reason, whosoever, institute and the investigator. So, oh, sorry, this point is a point by itself. So the sponsor may terminate this agreement, okay, with 30-day prior notice, like removing your job with 30-day notice without any cause. Understanding?
So what will be the where will be the value of adequate number mentioned?
That's what it's not mentioned here.
Okay.
Not mentioned here. So like this, there will be you will be encountering CTS. So if you are working as an investigator or if you are working as a coordinator, it becomes your responsibility to read each and every point thoroughly. Once you sign it, once it becomes a legal document, like it will be signed on 100 rupees bond, 1,000 rupees bond, right? This is just a draft white paper. But once it's signed and it becomes a legal document, you cannot revert it back. You cannot tell that, array, I did not read it. You cannot say like that. Got it?
Okay.
So on termination or expiry, what should happen is written, will deliver all investigator product trial material within 14 days of date of termination or expiry, will return any sum paid for services which has not been performed before the date of termination or expiry. So this is very important. See, the sponsor might give you some amount prior, like study startup fund or for managing a SA, which happens suddenly. Let's say they have transferred you, like you raise a invoice, there is a facility to, there's a provision to raise an invoice against taking SA fees prior, like for safety. So you have taken the fees priorly, like let's say 1 lakh you have taken it, okay, and no essay has happened, no one got admitted for adverse event or anything, but you have to return this amount. So you have to be very careful. You are not using this amount for anything else, okay, because you have to return it. Understood? And sponsor will provide you sometimes laptop, computer, refrigerator. So it is very important what is written here, okay. So you might have you have to return all those equipments. Again, this is an important point here. Okay? IP is very important. Investigator product, anyhow, IP is very important. So even used IP is important. It needs to be sent to the sponsor for destruction if the destruction facility is not available at you. See, on termination or expiry of this agreement for any reason, okay, FGG will pay for all services performed by the institution and investigator to satisfaction of this particular company in compliance with this agreement. So, is this a good point or bad point? You guys tell me.
Good point.
Good?
Investigator will be paid, right?
Yeah. So, in the previous case, we thought he could terminate the project, right? But no one will do it in real world. No one will do it. Suddenly they won't terminate if without having a valid reason, okay, because they have to answer the DCG as well. So but these kind of points will be there in the clinical trial agreements and we should be aware of it, okay. They will terminate the project in few cases where where in the interim analysis it is proven that drug is not working as it is intended to work or it is causing more harm than benefits. In that case, trial could be stopped, okay. So there are few such cases in which trial could be stopped, but in most of the cases, reason will be given to the investigator why it is being stopped, and prior notice also will be given. So if it is not given or the trial is stopped, all whatever the PA has spent for doing this study, it will be paid. So this is a saving point. So upon the discontinue of this agreement, all the responsibilities would cease for either parties. So what is called as intellectual property will be written here. Okay, the trademark, their protocol books, investigator brochures, data, everything will be proprietary information or intellectual property of sponsor. See, publication rights is written here. The sponsor has exclusive rights to authorize and all publication or communication relevant to trial study, and investigator undertakes to make no presentations or publications of the results of the trial study without prior written approval of the sponsor. And the timing of said presentations or publications. So when the permission for presentation or publication is granted, institution and investigation agrees that prior to submission of manuscript, abstract or publisher, institution and or shall forward a copy of said manuscript. So for anything prior permission from the sponsor is required. So what is the relationship between parties is written here. This is not employer-employee relationship. They are individual service providers or individual independent contractors who mutually provide service to each other. That's all. So there is something called as force majeure. That means in cases of this agreement shall not be binding in cases of any unexpected things like fire accidents or natural calamities or outbreaks of any diseases, etc. And that too for a particular time period until which the outbreak or natural calamities has happened and time has been given to recover takes. Okay. So provided that if a such event continues for more than 2 months, a party may terminate the agreement, giving at least 15-day notice, right? This is important as I told you. Governing law or arbitration. See, any disputes which cannot be settled amicably or mutually by talking within period of 30 days, okay, shall be settled in accordance with arbitration rules of Mumbai Center. But you might not be based in Mumbai, you might be based in Chennai, you might be based in other Indore or something. So it's always better to have the matter settled in the courts where your institute is residing, right? So I'm in Hyderabad. So my favor would be change this to Hyderabad Center. Got it?
So that has to be included in the agreement, right?
Yes. This is all. This everything is in agreement itself. But what is written in agreement is important, right? So this is to be included in agreement. So in which courts you are going to settle. So if you are agreeing for settlement in Mumbai court, for each and every date they will call your principal investigator to Mumbai court. You have no option but to attend there. Understand? But you're not staying in Mumbai, you're staying in Chennai. So it will cost you money, right?
Yeah.
So this is a point which you need to be very careful about as well. So these are some basic things. So any legal notices where to be sent, all parties addresses will be there. And here finally people will be signing. Once it's signed, it becomes a legal document, then it's done. You cannot change it. So you got an idea of how clinical trial agreements are made.
Yes, sir.
Okay. You have any doubts in this? You can ask before we go to budget sections. No, yes.
No.
In
Yeah. Yes.
in the invoice section for the laboratory, release laboratory invoice, you had specified about some time period. Can you just repeat that once again?
Yes. So you understood the process how invoice is made, right?
Yes, sir. Understood.
So whenever the lab tests are done and you enter the data into the ECRF, and once the company verifies, person verifies that data or that visit has happened properly, then they gives you permission to raise the invoice. Okay. Once the invoice means like you giving them a bill, like this is how much it has costed me. Okay. So upon that invoice, they will send you payment. You show them how much it costed you, they will give you the payment. So it is important to know. So in some cases, your institute will give you the credit, right? So so you're working in some hospital in order to encourage clinical trials. So institute will give you credit. Credit means it will give you some time to pay back the lab costs. So it will allow you to do the lab test for particular limit. There will be there. So some institute will allow up to 1 lakh you do lab cost, but they will have a time frame of let's say 25 days. Okay, within 25 days or 20 days you have to settle that amount. Understood?
Understood.
But in your agreement, there is mention that we
30
are
days.
going to give you money in 30 days.
Okay,
But
understood.
how is it going to work?
Yeah.
So this we will discuss in payment terms. Okay, in coming slides we will discuss this in detail.
Okay, sir. Thank you.
So any other doubt? Can we move forward with budgets?
Yes.
Yes, sir.
The reason because I did not make a PPT and tell you everything in a PPT is each and every point is important in that CTA. So it makes sense you to directly show the CTA other than to discuss about in PPT, right? So this was it. So what do you think is cost getting a drug to market? Greater than 100 million. This is all dollars. Greater than 2 billion, greater than 4 billion. How much?
100 million.
100 million.
Yeah.
Dollars, right?
Yeah, these all are dollars. Though, then imagine how much it will cost in rupees. Let's check that.
10,500 crores. Right.
Yeah.
2
So,
billion.
okay. Any other number? So it will cost across 2 to 2.5 billion. Also, this data is few years old. Okay. So 2 billion means how much you take? $2 billion in rupees, Indian. So it will cost you this much. I don't know it is crores or. So it costs them a lot, right? That much we can say. It is 10 crores. 1,000 crores. So 1,56 crores or something. It is 1,56,000 crores or something. It is costing them. It is huge amount, right?
Yes,
Yes.
sir.
So that is the reason they are very careful about their data. So so by mistake, some information about the interim results or something has been leaked out, but the competitor can change who is in the development stage can change the molecule, right? And release a better version than them. So this is all business as well. So like this, they will be very careful regarding what is published, what is confidential information. See, study budget can be given in two ways. It could be flat budget per patient enrolled, but it could also be divided. Flat budget means, let's say patient has to come every month, once in a month for 10 cycles. Okay. They will say you do lab investigations, admit the patient or anything, including your fees, we will give you 30,000 per visit. So it includes everything, PI fees, investigator costs, admission charges, everything. Okay. Per visit, we will give you this much, or per patient total we'll give you this much. This is a flat budget, no breakup. But in some budgets there will be breakup, like where complicated oncology studies are involved, where different tests are done, some done centrally, some done locally, admission is required, AEs are coming, lot of them. So in that case, most of the time budget will be broken up into different parts. Okay. See, there are different factors while analyzing the budget. Shall I show you the budget first?
Yes, sir.
I think you will get better idea. This is study name and demo study name. It's just a dummy study name. So it is a broken up budget. Okay. If it was a flat budget, nothing like this it will be there. For week one, so for visit one, this much, visit two, this much. It will be a simple table. Okay. So screening visit, this is the amount. So you are aware of overhead charges, what it means?
No, sir.
See, any institute is allowing you to do the study, right? So it has to give you a department, research department, your patients are coming. So it costs them to give them space, provide you lighting, your refrigerators take electricity. So they take something called as overhead charges. So upon whatever income you are getting, they will take a percentage of it. Okay. So that overhead charges will be given by sponsor. So some sponsor will say this much including overhead charges, but we should always be careful to get overhead charges extra out of the subject cost. Correct. So this is very important to know how much is the overhead charge of your institute, and you get it extra from the sponsor. And also now GST is present, so it should be written in the document in the CTA that all applicable taxes like GST or anything shall be paid extra upon the final invoice, right? And in the invoice also you should claim the GST. So this will be the breakup like this. Okay. So this is the investigator grant or investigator uh, visit cost. So like for seeing the patient and doing some basic lab, sending the sample to uh, central lab for say this study has visit where the PI checks all the vitals and sends the sample to central lab for checking particular parameter, PKPD or something. So this will be the cost, overhead charges, total cost. Okay. And this will be for individual patient, and this is for the 10 patients, same thing. Okay. Investigator fees, at least 2 doctors. So what is the investigator fees? For 10 patient is this much. So for one patient is this much, for 10 patients it is this much. Okay, total investigator fee. For treating one patient they will be getting this much. So like this it is divided. Okay, what is the travel fee given per patient? Okay, so for per patient for traveling they will be giving 1500 rupees into 8 visits. So the study duration is for 8 visits. So let's say they will give 12,000 rupees total. So for 10 patients it is this much. Okay, phlebotomist charges how much, local lab expenses. So all tests are done centrally except few tests which are to be done locally. Okay, like simple CBP, etc. So per test how much it will cost. So this is not a standard thing. You have to send what is the cost in your hospital labs. Okay, and archival fee, here it is 0. This might be due to site not having archival facility. Okay, to store for 15 years. If there is an archival facility, they will give the archival fee also for storing. But this will be the total budget. How much is? Got an idea how budget looks?
Yes, sir.
Yes, sir.
So upon this we will discuss now. Budget is the most, along with all the terms and condition, budget is the most important thing in order to successfully do clinical trials. You have to be very careful while checking the budgets. From my experience, I can tell you that no CTA has been approved. That means agreed the first time they send the draft. So always negotiations happen in terms of budget. Okay, so sponsor sends particular PI fees or per cycle fee this much. No one will accept uh, first time. Always negotiations will happen. So it is better to negotiate as far as possible for proper budget. Okay, so before analyzing, while analyzing a budget, you should see the protocol properly first. So what kind of patients we are enrolling, okay, what duration it will take, and what is the kind of drug which needs administration. So is it an IP model, in inpatient administration, or it is a tablet, you can give it to patient. So what kind of adverse events you are expecting. So in many drugs it will be written like we can expect these kind of adverse event, common adverse event like 15% vision loss is an adverse event. So these kind of drugs are also there. So what is the cost of the for treating that adverse events? See, if adverse events are more, patients are going to visit you frequently, right? So even if doesn't cost you for looking the patient, but you are spending the time. Doctor is spending its time. Okay, so that is also a cost. And what are the follow-ups? What is the follow-up methods? So all should be checked thoroughly, and you should also check all the costings in your hospital and all the proposed costings. So you should speak with the management or administrator in the hospital in coming future. Is there any plan to increase the cost of so and so test? Okay, so and so admission costs, etc. So you should be thorough with what is the cost at your institute. Okay, and again institutional overhead, GST, etc. You have to know what is the EC fees, and you have to know what is the average salaries which are to be paid to the employees there, like CRC. So in Bangalore the cost of living is different, in Mumbai cost of living is different, in Hyderabad it's very different, right? So you should be aware, like for how much salary your employees are going to work for you happily and will stay. Okay, you should be aware of it. And what are the additional equipment which are required to be procured, like centrifuge is required or cold centrifuge is required, other kind of refrigerator is required. You will be knowing it at the site. Okay, and what is the payment model in the institute? Okay, how are you going to recover that? So many institutes ask sponsors to pay money into their account, not investigator account. Some institute allow payments to investigator account or salary to CRC account directly, but some institute does not allow it. They will first take the amount from sponsor and then disperse it to PI or CRC salary or like that. You should know what is the payment model in your institute, because each payment model has its own timeline, right? And of course I told you how many subjects you are going to enroll, you should be careful about. And by looking at the protocol you will know how difficult or how much time it will take to enroll particular kind of patient. See, what happens is in most of the protocols you payment will be made only to the cycles. As you have seen, will be made only to the cycles, not to the screen failure patients. So there will be a limit of screen failure to enroll patient. See, for I'm saying an example, the criteria is 4 is to 1 is to 4. Okay, for one enrolled patients consider 4 screen patients. So if you are enrolling one patient, okay, that means screen pass patient who's taking who has started taking the drug. Okay, but other 4 are screen failure. Okay, as you have enrolled one patient, they are going to pay you for 4 screen failure patients. Got it? But only one patient is there. You have screened 6 patients. Guess 5 are screen failure, only 1 are enrolled. For the remaining 1 patient, they are not going to pay you. So these some CTS will be like this. So there will be a limit as to how many are going on screening. You can't go and screen every patient, right? So, so by enforcing this, should be very careful while checking the eligibility criteria. See, some protocol will have hepatitis B negative as exclusion criteria, but all are patient is fulfilling basic criteria. But after checking, you find that hepatitis B, after taking immune screening, you find hepatitis B is positive. Then you can't randomize that patient, correct? So, so prior only a PI needs to check all these criteria to get the payments properly. Understood?
Yes, sir.
So eligibility criteria checking is very important. So as I've told you, like when you break up the budget, it is broken up into 3 parameters basically, like per subject cost. Okay, per subject cost means that visit cost or the PI fees. So that visit cost most of the times also include the PI fees, or sometimes the visit cost will only include visit cost. So you are treating the patient today, for this visit we are going to pay you this much, including admission charges, etc. But the PI fees we are going to pay you separately, or sometimes they will include both and call it as a visit cost. Then the institute internally will decide how much PI will be getting and how much institute will be getting. Okay, understood? Okay,
Yes.
and next thing will be study cost, startup cost. So in order to start a study, you need some fund, right? You need to, you may not, you may be required to procure a computer, or you do require to pay travel fees of patients coming for screening or something after randomization. Okay, first invoice is not raised, right? You are not given treatment to anyone, so you have to have some cash in hand. So that will be called as study cost, startup cost. Okay, to buy documentations, etc., all zero, or maybe Xerox machines, laptops, anything. So you can cover in the study startup cost, and it will be written what all you can purchase with that money. Okay, and something called invoiceable costs are there. These costs you do not know it will happen. Like patient has come for unscheduled visit, something called a scheduled visit will be there, something called unscheduled visit will be there, right? So an adverse event has happened, you had to do some additional tests. So for the additional test you have not expected, so those are invoiceable costs. So unexpected costs. So these are the 3 major categories in which budget will be broken up. Got it? And of course, there will be cost for overhead charges, GST will be there, and for SA management, how much you should spend will be there. So, got an idea how the budget will be broken up?
Yes, yes.
Yes.
Okay. So, while working as a fresher, if you go into an institute, so they will not involve you in a budget things, right? Do you think they will involve you?
No,
No.
sir.
No, sir.
No one will tell you, oh, so how much we are getting, how much. So this you should be aware of. So because if they know you are capable of dealing with the budget, then they might entertain you to review the budgets, etc. Right? So this knowledge is very important. So because at the end of the day, there's a business aspect to it as well. So let's see what are the subject costs, or let us look at it as a visit cost per visit, what all are ongoing. So there will be some amount for patient care. So this you need to calculate prior speaking with the, you need to have an idea. So how much does it cost me to do one visit at my site? So everything which seems to be free is not free. You have to understand. Okay. See, let's say your PI is spending time. Okay. It might not cost, it might not look like you are losing money, but you are losing money. Like, see, if you calculate per hour how much he is earning, you can calculate per 15 minutes how much he is going to earn, that earning potential. Okay, if they are spending time for, if the A's are more, adverse events are expected, adverse events are more, but people are that clinical trial subject is going to visit the hospital frequently, right? Then the PA has to spend particular time. So that everything you have to be aware of. Got it? So patient care is like procedures like lab tests, what has to be done, and CT scans, etc., blood treatment administrations, admission into IP wards. So that, like, other cost is that for travel reimbursement. They will be giving some amount for patient has to travel from far away or even from his home is coming. There will be provision of travel costs. Okay, here you should be careful, like what kind of patients you are visiting your hospital. Let's say it is a mix of only local patients, like your hospital is far away place in some district and only local patients come here, then it's okay if they give 1500 or small amount, if they, it's okay because it's not much far away from the people, your hospital. But yours is a multi-department hospital, big hospital in a city where people are coming from different places, even from different countries they are coming. Then the travel cost has to be in two ways. Like for local patient within 150 kilometers, how much you are going to give, and for non-local patient, you are coming from different city. I mean, Hyderabad, someone is coming from Vijayawada, Vishakhapatnam. It will cost them, right? At least good amount you have to reimburse. So it should be written in the agreement. So for local or non-local, what is the limit? Or else you can have a limit, it's like up to 3000 you can give, up to 4000 you can give. So this you need to know what kind of patient pool is coming at your hospital. And personal costs might happen. Personal cost means how much physician is going to be get paid, coordinator, what is the coordinator salary, what is the nursing salary, lab, what kind of facilities you already have. And if you can always delegate a nursing person who is already available there, you can train them to ICH GCP, you can, and delegate them into study. But you should be aware what kind of workload they are having. Okay, is there a necessity, you have to think, is there a necessity for me to appoint a new nurse only dedicated to clinical trial, or I can train and manage with the already existing nursing staff. This is important. This goes same for the lab personnel also. Okay, depending on your requirement you should negotiate the budget. So understood this much?
Yes.
So these are like responsibility of study coordinators. So they spend time doing all these things, no? Recruitment, screening, consenting, randomization, review of diaries, pill count. So all these things, essays, even essays happening, reporting should be done within 24 hours. No timing. If it happens at night, morning early, you come and collect all the information and report it as soon as possible. Right? See, there are some things. Okay. So all this will cost you something. So you have to be careful. So PI will get PI fees and online training. They have to attend online training, investigator meeting. So how you should ask the sponsor how frequent investigator meetings will happen, how frequent on-site meetings or off-site meetings. So PI has to travel to some other place to attend a PI meet. Something called as PI meet will happen. Often these are happening online these days, but it can happen offline way also. So is there some provision in the CTA which allows the PI to claim his travels or fulfill his travels is a question. Okay, this is also you should be careful. Again, I told, see, time is money. So some more things you need to check again is it an inpatient or outpatient setup? So inpatient will always cost you more, right? Inpatient study administration, inpatient kind of doing study will cost you more. Okay, what are the future amendments you are going to get will also determine what will cost you, like adverse events happening, the number of serious adverse event happening in the previous trials. You also need to check that will change the amendment structure, and that will also affect how many patients you can uh, screen or enroll. Like again, adult or pediatric patient, what is the duration of the study? Okay, so if the duration is very less, so if the study duration means, that means enrollment time, especially enrollment duration is very important. So if it is a moderate to rare condition and the enrollment period is only 6 months, so it doesn't add value to invest in all the equipment, buying refrigerator, buying centrifuges and keeping active. But if the enrollment period is high, okay, let's say the enrollment period is 2 years, 3 years, and there is an option to enroll multiple patients, 20 patients. So all this investment you can recover, right? Understanding what I'm saying?
Yes.
Okay. So and this how complex the study is also important. Like phase 2 studies are there. Frequent blood sampling is required for PD analysis. Frequent blood sampling is required. Like for every 30 minutes, blood sampling is there. Every 2 hours, blood sampling is there. So how complex it is, how much time your staff has to spend. So let's say for every 3 hours, blood sampling is there throughout 24 hours, 1 day in 3 months. So you need to have additional people, right? So again, amounts of resources used, special training required. So if the study has special devices or for measuring BP or anything, is the new devices are used. So what kind of training, extra training is required is also important. So all these things we need to be considering, okay, before analyzing and negotiating the budget. So again, we can see, did we miss out anything? So these are hidden costs, right? No one expects them. So sometimes there will be need for reconsenting. So consenting period, once you have taken the consent, you have to do screening test in particular period of time. Every protocol has particular period, right? See, let's one protocol will say within 30 days you have to complete your screening period. That means uh, you have done the lab test on first, okay, and the patient is eligible. You have to dose him by next month first, okay. But if you are not dosing it, your lab test results will expire, okay. Then you have to reconsent the patient sometimes or re-screen, okay. So that is there. Local IRB submissions, amendment. So how much does it cost? So how many amendments are going to come in the future? You should expect that, because submitting the amendments will cost amendment fees, which most of the time sponsor will pay. So how many monitoring visits are required? So the sponsors CRA coming into your sites, and your PA has to spend some time with him. You have to spend some time with him. Okay. And the printing costs, say your EC only agrees paper documentation. Okay. No electronic documents. So there are some ECs still now like that, ethics committees. But you are getting COMs, list of side effects throughout the country, or if it is a multinational study throughout the world, you are getting COMs. So each month you are getting 140 pages book. So you have to print it and you have to submit it. So there are some hidden costs, right? So teleconference attending, again I said, meetings, study delays, unscheduled visits, completing CRF. So follow up, how are you going to do follow up? What does it cost to do follow up? Long term follow up. See, the protocol is written for every 4 months you are going to do follow up for next 2 years or 3 years. Okay. Or till the patient survives. So all these conditions you have to take into consideration, right? These are something hidden. These we can call as hidden costs, unexpected costs. Understood?
Yes, sir.
Yes, sir.
Again, check again. See, at the end, you have to check the once you have done, you have prepared your budget, you have negotiated, it's done, the final copy draft is sent to you. So does it include all components of your budget, like phone call, tests, procedures, all is fine. Even if they give single budget, like flat budget, that the amount match your amount, it should be checked, okay. It can cover actual cost of the patient care and personal. So what is occurring at the site, the salaries, it should at least compensate for the salaries of the personnel, okay, invoice items. So you should cross verify all the costs and the final draft. And does it include indirect costs, like for sending for distraction, for unexpected visits, for going to meetings, administration charges, okay, IV admission charges, like that, indirect cost, does it has. So you should check again the budget. And as I told you, payment schedule is very important. So when are they going to release the initial payment? Let us say study startup fund. Is there a facility of study startup fund in the budget or not. You have to check. Okay, when if it is there, when are you going to receive it? What is the time period? Like they can send it. You start the study, we'll send it within 1 month. So what is the time? So what triggers the startup cost is also important. See, in some CTA it can be written like once you screen the first patient, we are going to send, or once you enroll the first patient, we are going to send study startup cost, something like that. So per patient payments, when are they going to happen? So as we have discussed, like 30 days, 40 days, what is the turnaround time? Okay. So where you paid an advance payment for one patient, screen failed, as I told you, some sponsors can give you fund for managing emergency situations. So is there a provision there? And then sometimes call as closeout visit. Okay. So what happens is when once the last patient last visit is done, so in some CTAs they will decrease the salary of personal working there. So there is a provision of CRC salary. So they have mentioned the CRC salaries. It is not required to mention CRC salary separately, but some CTS as per your requirement will mention it separately. They will take some amount out of the total budget and give it to the CRC as a salary. Let's say they have mentioned it as 30,000 or 32,000. Okay. Once the last patient last visit is done. Okay. So all the patients are treated. Follow up is also over. Okay. Now it's done. Data is entered. Everything is done. But the site is due for closeout. Closeout means all the data will be finally verified. All the payments will be verified, and officially site will be closed. Okay. Until that time, that CRC is required there, but she will not be doing that kind of activity where the patients are present actively, right? So they will reduce the uh, salary of that CRC. They'll make it 50% of what she was getting previously, what she or he will be. So understanding. So this closeout schedules and what is the closeout cost for doing closeout visit, it should be clear. Got it?
Yes.
And if you are a principal investigator, you should be able to communicate with your CRC. This is the case. After the last page, last video, you will be getting only this much salary. So again, you have given an appointment letter to your CRC that we will be paying you 32,000 per month, but you have forgot to write the key term like only up to last patient, last visit and follow up is done. Then she will ask you, where is my remaining 15,000, right? This is important point.
Yes, sir.
And so they will be holding some percentage, like say 5%, 10% of your invoices, whatever you raise. Okay. So these invoices will not, to be honest, will not be on actuals. So uh, Alvin, you there? Hello, who's hosting this? Alvin, are you there? Let me call. Just give me a moment. Okay. Yep. Has it stopped, Alvin?
Yes, sir. Yes.
Yeah, great. So I just told Alvin to stop the recording. Okay. See what happens most of the times. Institutes don't give the actual cost as is a clinical trial. They will always cost some extra amount. So if the cost is 300 rupees per CBP, they will tell to sponsor that it's 500 or 600 institute, but it's mutually agreed. It's understood that that's how that's where money is made, right? But there will be some percentage which will be withheld, okay, by the sponsor until study closeout. So once the last visit is done and the study closeout is initiated, then that 10% or 5% will be given back. So for let's say in March you have raised an invoice and it costed you 10,000 rupees, okay, for doing study lab investigation for a particular patient. In that 10% they will hold and give you 9,000 like that. Got it? And this remaining money they will give you at the end of the study. So you should be careful how much percentage is being withheld. So how do you calculate this percentage withheld is you anyhow you will be sending some amount of raised invoice, right, cost, because it's a clinical trial. You will give them a premium cost, not the normal cost of your hospital test. So each invoice you will be getting payment, you should not be at a loss. So your profit can hold. Let's say 10% is your profit or 15% is your profit, institute's profit, and sponsor is withholding 10%. It's okay. Still you are in 5% profit. But if your institute profit is only 5%, but the sponsor is withholding 10%, then it will be difficult, right? You will be in negative balance. You can't continue doing it, right? You understood?
Yes, sir.
So you have to be very smart while checking this percentage withheld, how much is being withheld.
Why is that done?
Hmm?
The amount is withheld. I mean, only paid at the end of the 10% is paid at the end of the closer. So why is that done?
It's simple thing. See, you appoint somebody to do some work, right? Will you give them payment completely fully now?
No.
What you will do, you will give the payment, some payment you will give them at advance, and you will give them at the end of the you are constructing a house, let's say. Engineer, do you give it completely?
No.
The same logic, that's all. Just a business logic. At the end, when everything is fine, they will give the remaining 10%. So everything is according to rules and regulations. You have done it. Everything is so they have a control, at least some control over finances. So it should not be like for this visit you are given and it's verified, but at the end of the day you found out the data was inaccurate and everything. Then what will be the interest of the site team? Because oh yeah, we got the payment for this visit, so why will we do it? So this is just a pure business logic. That's all, common logic, nothing more. So this ends our presentation. So did you understand something out of this entire 2 hours?
Yeah.
Yes, sir.
So do you think it will be helpful while reading budgets?
Yes, sir. Absolutely.
Okay. So what I'll do, I'll share with you some template budgets, and I'll share you the link from where you can just download the templates as well. And I will remove a few points, few important points from the budgets, or I'll add some points, mischievous points. So you have to find out what are those points are. So let's say I have had a 10 such points modification which are unnecessary or which are harmful to institute or something like that. So you have to identify those points. Can you do it?
We'll try, sir.
Yeah. So that this is the only way you can learn. Just through experience, this you have to learn. As I've told you, there is something called as rules, regulations, etc. And another part is what happens in day-to-day activity. So in day-to-day activity, no one will ask you define phase two, define phase one. No one will ask you. It is better you know. But these are the kind of things people will expect you to do. Got it? So if you join as a CRC, people will expect you to know how to get a CDA signed and send, the proper way to communicating, how to collect feasibility information and send, okay? How to read CTAs, how to write source notes. So these are the kind of expectations you will be having at your workplace. But the background information you need to have is also very important. Like, what do you mean by phase two? What are the clinical trial rules? In how much timelines you have to submit? All these things you have to know. So these are two aspects you need to balance. Got it? Okay. If you have any doubts, you can ask. Oh, I think new people have joined. They've joined. Can they introduce themselves?
Manisha.
Hello.
Yeah, Manisha. Good afternoon.
Good afternoon, sir. I joined the CR course today only,
Okay.
and I am a PharmD intern at Maharishi Markandeeshwar Institute of Medical Sciences and Research, Mulana, Ambala.
Okay. Okay. Great. And three have joined. So Manisha, right?
Yes, sir.
So Manisha, we have a game, Manisha. Initially, because you joined late, I am telling you. So you have to add an adjective to your name. Like I will add I am a happy Pratik, or someone has had is a sincere Abhishek, like that.
Okay.
I will note down. So we'll call you by the name only, this name throughout the course. So who are you? Okay, you can think. So by all list of three I've introduced, you can tell. So who is the next
Only
one?
one, only one.
Only one, so you
Yeah.
have to tell. Like joyful Manisha, sincere Manisha, pleasant Manisha. So there are many things
Late
people have
joiner
got.
Manisha.
Huh?
Late joiner Manisha, you can.
Oh, so it's your option, Manisha.
So
Whatever you call.
later think. But meanwhile,
Yeah.
so I joined. Actually, I took admissions of all of you, but I did not join for many class. So today I thought I should talk. So how is it going so far? You can on your video if you are ready, or even if you are not ready, it is okay. I'm not video ready, but I'm still showing my face. So I want to see how all of you look.
Going good, sir.
No, but we wanted to see your facial expressions.
Yeah. So turn
after
on camera.
after 2 hours, what is your expression is?
So you can go to a place where you can turn on your camera for some time.
Going
Video on.
good.
That's all.
Mm.
Okay, and anyone else?
Jyoti has turned on cam.
Yeah, hi, Dr. Jyoti. So Pratik, this time we have few BDS.
Yes, yes.
Also. So you can share your experience or feedback, Dr. Jyoti.
It's going good, sir. I'm able to follow. Even if it's new for me, I'm able to understand.
Yeah, this is new for all others also. Basically, they have a subject, but the way it is taught is hopeless. Even when I was student, I read means clinical research subject in fifth year, and when exams came and when I was reading that subject again, I thought, what did I learn all this entire year? Nothing. Okay, all that did not make sense. But I took 2 or 3 days time. Then at least I got a gist or overview of how the trial happens. why those topics are in syllabus. I got a little understanding. So the advantage here is person who is doing that job for so many years will teach you. So that makes a whole difference. Anybody more? So actually now it is two steps. First step is your feedback when Pratik is here. Next step, I will ask Pratik to leave. Then you can share things which you cannot share in his presence with me. But now when he is here, at least I want few more, 3, 4 more people to talk and share their feedback.
Hello, sir. Good morning. This is Shri Priya.
Yeah.
As far as CR course is concerned, it is completely practical. It's not just a theory, it's something like that. And due to because it's practical and we are able to follow up.
Video you cannot honor today.
Uh,
It's okay, means if it is impossible, it's okay.
Actually, my laptop, I have to install something like a video thing. I don't know, the app or something, so it is not supported.
Contact Alvin. He can help. Or next time, maybe join from phone where you have a video.
Okay, I'll join from phone. I'll just disconnect now.
Next, Sneha. Sneha Keshwarap. First person who filled this Google form is Shivasai. Vankipuran Shivasai. Unmute and talk.
Hi, sir. Good morning.
Hi.
Hi, sir. This is Shivasai I'm an intern right now.
Mm.
So I'm from Shastra College of Pharmaceutical Education. My
Okay.
brother, Dheeraj, referred this program, sir. He's actually there in the previous course session.
Mm. Okay. Who's your brother?
Dheeraj, sir. Dheeraj. He's my senior.
Mm. From which college?
Shastra College of
Shastra
Pharmaceutical.
College, right?
Yeah, sir.
Okay. No, I want your feedback about this module, not about your brother. So what? So far,
Very
how is it?
interesting, sir.
Then along with you, your friend Chiranjeevi joined. Who is the other one? Yeah, Chiranjeevi. I want to hear from you. Mm. Sabhishek, what's your feedback?
It's going good, sir.
So one girl, I think Ashwati said going good. Everybody is saying going good. They are not even changing words also.
Some topics are like and
Some topics
regulation.
are like boring, sir.
So, so it's not actually boring for me, but we need to remember all those things, right?
It's like a dry topic, sir. Some topics are like a dry. Some are quite
Okay.
interesting to learn.
Yeah, but end of the day, we should learn everything. Dry, wet, interesting, not interesting. If it is useful, if it is going to help.
But there is a difference, right, sir? Regarding topology, regarding to therapeutics,
Hmm?
like that I'm speaking. Regarding to pharmaceutics, regarding to pharmacology, there's a difference, right, sir? Like that I'm speaking. While going to pharmacology, it's quite interesting, right? While dealing with the drugs, it's quite boring.
I don't feel oncology is interesting. It depends anyway. So, but ultimately, if it is going to help at the end of the day, we should
Yeah,
learn.
it's very helpful.
Yeah. So next, Pratyusha, Samskruti College.
Yes, sir. Hi, sir. Hello.
Yeah. Hello. We can hear you.
Yes, sir. Yes, sir. It's fine, sir.
Would you fine with no?
It's fine. It's interesting, sir. Actually, we are learning new things.
So compared to what you
And
learned in fifth year, okay.
yes, sir.
So did you learn anything more?
Yes, sir. Practical experience, where how practically it's going, how it will be. We are getting an idea, sir.
Okay. So you speak Telugu or
Telugu, sir.
Telugu? No? Okay. Next, Preeti. Preeti from Government College.
Yes, sir.
Yeah, your feedback.
Very informative sessions are there, sir. We learning very much new things.
Okay. So now Pratik, you can leave.
Okay, guys, have a good day.
Happy weekend, sir.
He left. I will pass that information then. Okay. So yeah, if you want to share anything with me which you cannot share with Pratik or other preceptors, you can share. Tell me now. Ideally, the best thing is you should have freedom to tell when they are there also. So next time when I ask, I will ask in their presence. But now at least today to make you little comfortable in case you want to share something, you can do now.
చెప్పు లేదు ఇంక మాట్లాడుతున్నాడు.
Nothing.
ఆయన కార్తీక్ సార్ వచ్చాడు మాట్లాడు. కార్తీక్ అరే ఆయనే కదా మనం జాయిన్ చేపించింది ఆయన మొత్తానికి.
Hello.
No, sir, nothing as of now. For me, it is interesting, so I'm able to follow up with all the aspects of the class.
కనెక్ట్ అవ్వదు మళ్ళీ.
Okay. So one thing which from our side is we will try to stick to the schedule which we have given, but sometimes because of unexpected travel and meetings that might slightly change. We will inform you before, okay? Because I don't think any other institute will give entire schedule beforehand. So we give it and we will try to make sure that we stick to it. But sometimes for unavoidable reasons, things might change. We will inform you in advance and make sure that you know the change in schedule. Okay. I think that part we should improve because in this week I think we have rescheduled one or two sessions. So and Manisha, I can share Pratik's contact number with you. You can connect with him separately and maybe see if just he can give an overview of what happened. Okay. So for you,
Okay.
when we announce next batch, that I cannot assure now when I will do. That time you can join again and means attend all the sessions without paying extra amount.
Okay, sir.
But to have that flow, you can talk to Pratik whenever he's available and just to get a overview or make some friends in this module.
Okay, so sure.
Ask them to explain all that with you. Okay, it will be a practice for them. It will be a learning for you.
Yes.
So my next question is: are you talking to each other? For example, two people joined from Shastra College, and they might be friends. They might be talking, but are you talking with somebody who is outside your college?
Yes, sir.
Yes, sir.
Yes.
Good. Okay, good.
Sir.
Yeah, make in connections. Okay, you don't have to limit yourself by talking to people who you know. So one more opportunity is module presence is to make connections from people from different colleges, not in a hope of they will help you or you will help them, but just to know some other person and be friends. Okay. And to be very honest, at this stage of my career, all my work is because of my contacts. It is not because of some knowledge which I have. Earlier day, when I was a student and maybe after graduating for a few years, all the work I got was because of my knowledge. That will anyways be foundation. But at a certain stage, it is no longer about knowledge, at least with me. It is all about my connections and relation I have with people. For example, if you just take Pratik, so today Pratik is taking this module. Simple. Earlier he was a student. He attended few of my workshops, etc., etc. So we developed contact in that way. It matured, and then now he is a preceptor taking sessions. And in fact, we got a study. Okay, we have not signed all the agreements. So we also have an sister concern for Avenida called Kairos. So basically, Kairos is a SMO. SMO means we approach the sponsor, we approach the site, take the study from sponsor and execute at the site level. Okay. So yesterday we got our first study. It is an oncology study. Though we have not signed all the agreement officially, I cannot declare that we got it, but they agreed and they are ready to give a study for us. And we are very hopeful that we will do that study within like, some time.
Congratulations.
Congratulations, sir.
Yeah. And again, the reason for doing that, there are many reasons I will talk later. But now he is also part of that company as the founder, one of the founders. Okay. So our relationship matured from a student to a preceptor taking this module and then to co-founder of a company which we found together. So that can happen. Okay. So try to maintain that professional relation with others.
Sure, sir. Definitely.
Okay, so you don't want to share anything about Pratik and this module. So that's now in general, if you want to talk with me, share anything with me, ask me something, you can do. Nothing means we can end this meeting. If you have anything to ask me, it need not be related to module. It can be general things also.
Sir, do you have
So
link?
when is the PV session going to start?
PV session will start July 17th. It's not 22nd, I think. This module is ending when?
17 July.
Yeah. So I'm planning to start PV from 22nd July, that weekend. So that is ready, and today I will get the final topics and schedule of CDM. Once that is ready in 1 or 2 days, I will give all information. Okay. And for you, fee structure as I promised, it will be much lesser. For others, I am thinking 10,000 rupees PV plus CDM. The cost will be 10,000 rupees. Okay. But for all of you, let's say if you are paying 12,500 rupees for this module, I am thinking to charge 2,500 more for both PV plus CDM together. So that total you will be paying 15,000, not more than 15,000. Okay.
Okay, sir.
So it means you will get
That would
75,000.
be, yeah, that would be really helpful. Thank
Helpful
you.
for who? You are me.
Yes, sir.
Uh,
As
yeah. So I clearly said. And see, one thing is, so I'm happy that you have decided to join this. You understood. When we launched the CR module, I clearly mentioned that we will start with CR. Once CR is over, then we will start PV and CDM. Right now, currently, the registrations are open for CR. This is the fee for CR. Once we are ready with information, we will tell you about PV and CDM. If you join CR, you will get a big discount for PV and CDM. So is this information clear or not?
Yes, sir.
Yes, sir. Clear.
But everybody without us, then they will ask, sir, what about PV? What about CDM? So I'm talking about CR, and everybody wants to know about PV and CDM. So if that information is ready, if we are ready to launch that, we will tell that information. So I had to waste a lot of my time giving clarification about this. So people should become mature to understand that, okay, at this stage, this information is available. This is the information they have shared. So whether they want to go ahead or not, just communicate with us. But all unnecessary, except that core thing which we discussed, everybody is interested to know everything else. Let's say I took you to KGF movie and I asked, how is KGF movie? Then everybody asking, sir, are you planning KGF 3? Who is the hero? Who is the heroine? So, so I said, let's talk about KGF 2. Then we can think of 3. So I'm happy that all of you understood that and you have joined. So, and with you, as I said, no category of fee is separate. For example, if you have paid 11,500, the maximum means all three together will not exceed 15,000 for this 23 students who have enrolled. For others, PV plus CDM alone will be, means PV plus CDM together, I'm looking to charge 10,000 rupees. Later, if they join CR fees, I'm not going to decrease. It will be 12,500. So it will be 10,000 plus 12,500 for them. And if they join both PV and CDM, maybe later when they join CR, I might give them some discount. But as I promised to you, you have taken that initial step. For you, all three together is 15. Okay. So PV schedule is ready. CDM, I will get it today. Once that is done, I will put it in your group. Okay. And for PV, one person will officially take all the topics. Other person will complement that thing. So what we are trying to do is teach you two things: the job aspect of that work and the core essence of that work. So PV, we can simply see it as a job where you will do certain things and you will make some money. So that anyways, you should learn, you should know, because ultimately everybody is joining this to get some job later. But only people who truly understand the essence of that subject or the field, pharmacovigilance, essence of the field, clinical research, then they will perform better. Because I have seen people who are doing great job in CR because of two qualities. One is they understand the job aspect of it. Other thing is they understand the value of working in CR, the essence of clinical research. So they work with more passion, more involvement, and when you do that, naturally you will grow and you will be much more successful. But if you only know the job aspect, not the essence and value, you might be stuck and your growth chances might be minimal. So with PV, we will have two people. One of them will talk about the core job aspect, what exactly you need to enter into that field. Other one will try to tell you more of essence